What's up, everybody? Welcome back to another episode of the Square Feet of Life. I am your host, Johnson Francois, and today I have a very special guest with me, Dr. Uzair Hammad, aka Dr. Z of Orlando Health. Dr. Z, how's it going today, brother?
Hey Johnson, going good. Thanks for having me, man.
Of course, man. It's a pleasure having you. Dr. Z, I actually wanted to talk to you today about SCI and TBI as it relates to physical therapy. How did you decide as a physical therapist that this is the niche that you wanted to embark on?
And that's a good question, Johnson. SCI, spinal cord injury, and TBI, traumatic brain injury, was something I didn't even know existed really before PT school. And once I got into PT school, I found it fascinating just learning about the brain and the nervous system. But I was always very intimidated by those type of diagnoses just because it comes with a lot, not only uh, mentally taxing, but also emotionally having to deal with the families and just the kind of a burden of care and just the emotional aspect of having this life changing circumstance happen to someone was always kind of intimidating. But as I went through my clinical rotations and worked with sports athletes and then older populations, my final one was with a inpatient neuro, so an inpatient rehab hospital. And when I was interacting with these patients and getting to work with them, I've never felt that type of just that drive to jump out of bed and go, work with them again the next day. And so being aware of that and recognizing how it really fueled me to help them, um, I was like, I got to do this. I got to specialize in spinal cord injury and brain injury. So
Is it safe to say that your challenge became now your passion?
absolutely, absolutely. Um, I think passion drives me. My why kind of drives me. So before I make any decision, it's always, well, why do I want to do this, or why specialize? And so, yeah, I think those two things go hand in hand.
Nice. Dr. Z, a patient comes into your office and says, I've just suffered what I've been told is an SCI injury or TBI injury. What is the difference between them both, and how do you go about treating it?
Typically, I'm walking into the patient's room, or if they're coming to me, it's well known that they've had a spinal cord injury for a little bit, just to kind of paint the picture for the audience. So, the I guess the way it'll end up working is that someone might be injured from a car accident, or a fall, or a some type of traumatic event, gunshot wound, whatever it may be. And depending on the location of the damage, whether it's the brain or the spinal cord, which is the continuation of the brain that helps the brain communicate to the rest of the body, I kind of call the spinal cord the highway system between the brain and the rest of the body, and then the brain being the control center. So the real main difference between a spinal cord injury, SCI, and a brain injury, TBI, is the location of the damage, but then they present completely differently, of course. So your question was, how do I approach someone maybe with a spinal cord injury? So when I walk in for the first time, it's a pretty delicate situation. The patient was just in the acute care hospital in the ICU for maybe 4 weeks after the original accident, and they've realized that they can't maybe move their arms or their legs, um, and they're really scared and terrified essentially. And some of them may have been told that you'll never walk again. So it's a delicate situation to approach. So I always kind of take a deep breath, recognize what I'm walking into, and when you first walk in, I try to just, I don't talk about their injury. I kind of just look at them as a human being, um, because I already know the first question that's going to come from them is, when am I going to walk again? Or am I going to walk again? Which is always a tough conversation to have. Um, but, using our different assessments and tools and doing my evaluation, after that's completed, I'm able to better guide my patients. The ones that do have a chance to walk again, inherently, those conversations maybe go a little bit easier because I'm telling them, like, hey, there's hope. And although I'll never tell anyone that you'll never walk again, because no one should say that, there's always a little bit of a chance. There's stories of people that shouldn't have made recovery that maybe 10 years later, all of a sudden, started moving a foot and then went to rehab and started walking. So I'll never tell them never, but I do try to keep it realistic, and I don't want to set false expectations either. It's a tough question to answer in just one way because everyone is, obviously very different. So that's for spinal cord injury, where cognitively they're still aware. It's like you and me having this conversation, except the person's now just in a wheelchair, right? The wheelchair is now their new legs, and our neuropsychologist works with them a lot, trying to help them, because none of us think about walking. None of us, if I ask you, Johnson, who are you? You're not going to tell me I'm a walker, right? You are Johnson, and you have things about your personality and your wants and desires that make you you. And after some type of, or after a spinal cord injury, all they start thinking about is walking. My family's not going to love me anymore. My friends are going to leave me. And so kind of working with the neuropsychologist to help reframe that. And it's like, hey, before this injury, if I asked your daughter, what do you love about your dad? She's not going to say, I love his walking cycle. You know what I mean? So that's a conversation that needs to be had. So I mentioned that they're cognitively intact, meaning they're with it, right? There's no brain damage, so they really know what's going on. A brain injury is different, kind of the wild, wild west. So depending on there's different stages of recovery after a brain injury, and it goes by the Rancho's Los Amigos scale. And these stages go from 1 to 8, or 1 to 10, depending on what skill you're looking at. But the higher the number, the more intact their cognitive function is. Typically, when you walk into a TBI room for the first time, though, since they're in rehab, they're at stage 4, which is labeled as confused and agitated, meaning they don't know where they're at. Anything can really piss them off at any moment. You have to be really, it's kind of, how do I want to phrase this? You're not manipulating them, but you're definitely manipulating the situation to get your desired result. After a brain injury, it's quite fascinating and especially scary for the family. So a lot of it at first is also educating the family, because the patient in front of me is not going to remember anything I tell them in that given moment, actually. So my job is to just prevent agitating them and getting them to move and facilitating the recovery process. But the family's obviously very scared. All of a sudden, their loved one is yelling profanity that they've never yelled before, or doing things that are just completely inappropriate. And you'll have a mom like, I swear to not raise my son to talk to people like this. And it's really just like, hey, he's not doing this, right? It's our primitive functions, kind of like what the area that separates us from apes, right? That kind of goes away. And we kind of go back to those primitive functions and start yelling, screaming, fighting, whatever it may be.
How much of a surprise was it when you must have realized that, although I am a physical therapist, I do have to rely on the therapist side a lot when it comes to dealing with patients and the family's emotions. How have you been able to deal with that upon entering the field?
That's a good point, man. So honestly, right, you don't think about that when you're first coming in. I thought I was going to work with people after surgery maybe and help them get stronger, but the emotional aspect of it, the ability to make connections with my patients and really try to put myself in their shoes is what I love about my profession more than anything, actually. So yeah, it was a little bit of a surprise, but an exciting surprise. And getting to every spinal cord injury, every brain injury, they're going to be different. So it's like, how do I treat, not that diagnosis, yeah, I know where your damage is, but what makes you you, and how do I use that to help achieve our common goal, right? Which is helping them improve in whatever element. So um, I don't think you can be a good therapist without that therapeutic alliance, is what we call it essentially. Um, Without that, it, there's no buy-in. Your patient, it's a team. It's a team effort. So,
Yeah.
great question.
Yeah,
Yeah.
absolutely. So you mentioned earlier some of the causes of SCI and TBI injuries. What are some of the common causes that you see a lot more than others? I know car accidents are a big one. You mentioned gunshot wounds, but which ones do you see happen to be more prevalent?
Yeah, and there's actually a lot of research on this. We know that globally, there's, I believe, globally about 1.5 million spinal cord injuries. And then in the US, we have about 17,000 new ones every year. And so they take these statistics, and what we know is that the largest cause of a spinal cord injury in individuals less than the age of 40 is car accidents. And then older than 40, it's actually falls. So in our older population, um, it's usually falls. And then in the younger population, this I guess isn't too surprising. It's usually males that are getting the injuries, and if I guess the philosophy behind why that might be is just more risk-seeking individuals. Um, Aside from that, though, aside from car accidents and falls being the two big ones, tumors within the spinal cord can take a fraction of that, and other physical abuse like gunshot wounds or what have you.
Yeah.
So the most common being car accidents and falls. For I think another fun fact to know is on July 4th, the percentage of spinal cord injuries is exponentially higher due to people diving into the shallow end of the pool. That's actually another really large reason for spinal cord injuries, which is unfortunate, just because of how much education, right, has been given out on that. And then for brain injuries, it's more the car accidents or a fall as well, really.
Yeah. Some of these things we can't control, right? Such as the tumors, car accidents, you could control it a little bit, but a lot of it also has to do with watching how other people drive. But you mentioned that over the age of 40, some of the more prevalent cases that you see that can either lead to an SCI or a TBI is a fall. What can we do to keep our bodies strong to make sure that if we do fall, maybe we have lesser of an injury or it doesn't escalate to the point of an SCI or TBI injury?
So as a society, we need to really, and I think we've been right doing this for the past few years. The wellness industry and just educating on nutrition and all that has definitely taken a uptake. But stay active, working on balance, going to community community centers, and just staying active. Really, going for walks in the park. So the way I describe it to older people is, if you don't use it, you lose it. And as we age, naturally, we all know this, things start to kind of degrade, right? We're not as sharp as we once were. We're not as quick as we once were. We're not as strong as we once were. Um, some older people have trouble standing up from a chair, right? But then in the same breath, you might have someone that's doing deadlifts. So it's really about what did you do to maintain your vessel, right? The body that kind of helps you navigate this life throughout your lifetime. And it doesn't have to be every day. It's really just staying active, staying engaged, finding something that gives you an excuse to leave the house. Um, but if you don't use it, you lose it. So if you're not walking as much, you don't have to work on your balance as much. It's going to degrade over time, and you're more likely to fall. And as one more, just as we're aging, our bones are kind of getting more brittle, right? So strength training, as you very well know, can help with some of that, but it's a multifaceted type of situation there.
How often do you find yourself working alongside with, let's say, personal trainers to help patients get a little bit stronger in order to maybe accelerate their rehab?
Um, Not very often for my specific type of patient population and the time in their journey that I call it. During that time, not too often. But once they're done with their rehab, and no one wants to come to PT forever.
Right.
If you've ever gone through PT, it's not the most fun thing, of course, for the patient. But once they're back to reintegrating into the community and right going to school again, doing all the things that life has to offer, that's when we might guide them and tell them to go, to a personal trainer or get back into the gym. And personal trainers are usually pretty knowledgeable. If they ever have questions, they can reach out, but it's not like I really work hand in hand with them. Aside from that, there are in services that, some corporations provide or some professionals provide where they might go to a gym and just talk about a certain topic to educate the staff. But it really takes the the buy-in from both sides, right? That you can't just go educate people that don't really want you to come educate them.
Right. So a lot of these patients, when after they suffer an SCI or TBI injury, they become confined to a wheelchair. So now, if I'm correct or incorrect, please correct me. The goal is to get them walking again. There is a lot of different ways to address the situation of helping them walk again, and there's a lot of new research on getting their gait training back to what it was, or at least to a state where it could help them in their everyday life as their life has changed. What is the approach that you take to help a client get their gait training back, or their
Um,
gait back? Excuse me.
yeah, the ability to walk, right, is what gait is. I do want to clarify though that the goal is to restore their independence. And what that means is, can I get myself out of bed, dressed, showered, to work and back, right? Like just things that we need to do on a day-to-day basis. They're called ADLs, activities of daily living. That really is the priority because that's what gives us humans, once again, going back to that why and reason for being and what gets us out of bed. It's our independence. No one really wants to rely on anyone else. So that is the overarching goal, no matter what. Now, if someone has the potential to recover walking function, then it is my duty to help optimize that and get them the best recovery that their body can get. In certain situations where I'm not expecting immediate walking return, and I know that they're only going to be with me in the hospital for maybe 3 weeks, 4 weeks, because of confines from insurance. Back in the days, people with spinal cord injuries and brain injuries, I'm talking 10, 15 years ago, were able to stay in the hospital for 7, 8 months because it's a life-changing injury, right? Everything that you've known has just really, your life's turned upside down, and you have to relearn how to roll to your side in bed, right? Like simple things like that. So to kind of cover all that within 3 to 4 weeks compared to 6 to 7 months is right a lot less time. So how do we best use our time? Now I'm going to try to bring it back in. So now let's say we went through our evaluation and we know like, hey, you have a yeah, you can make walking recovery, right? It's not one of those 2 to 3% chance type of situations. Um, then we're going to initiate that. And your question was, how do we go about initiating it?
Mm-hmm.
Correct.
Yeah.
So what the research shows us is that in order to make the most optimal gains and facilitate neuroplasticity, so the beautiful thing about the brain and the nervous system is that it is plastic, and if you use it, you improve it till the end of your life. Um, that comes down to thinking, memory, also moving and strength, right? So what we're doing is facilitating neuroplasticity. The way we do that is using different types of technology, maybe like the exoskeleton, which is a robotic walking device, or a zero G harness treadmill, which is essentially a harness over a treadmill that can offload some of the body weight off a patient. Um, because obviously if they can't move their legs, we're going to need something to help this person stand up, right? most adults are anywhere from 150 to 250 pounds. So using technology to make sure that we're safe and that the patient is safe, right? Um, but aside from that, it's trying to take as many steps as we can per session and making sure that the patient's getting their heart rate up and working at an intense level. I'm not going to bore you with all the science there, but it's what is the safest way and most effective way to get this person up and starting to take steps. And at first, that might mean I'm moving your leg forward for you. And as your brain starts to make those connections, starts to rewire, so to speak, those highway lanes that I was talking about earlier, um, they start to move their own limbs. And now so once they're moving their own limbs, it's like, okay, let me put an ankle weight on there. Let me make this harder to continue improving. Would be, does that answer your question? I know that was a little all
Absolutely.
over the place.
Absolutely.
Yeah.
Um, you work a lot with these individuals in order to help them recover, and at times it can require a lot of strength from you. How do you keep your body in shape in order to prevent injury at work?
So, and this is actually huge because even being a male and someone that I like to work out, I actually maintain my body so I could do a better job at work. So that was pretty spot on, but not everyone does that, nor do I think it should be a requirement in the sense of my colleague who might be half my size and skinnier and all that. I I really want to emphasize this point is use the technology, use what you have available, get an extra pair of hands. Don't sacrifice your own health to help that person because then how are you going to help the next patient that comes in, right? So I go to the gym regularly. That looks different for everyone. That might mean I'm going for 10 minutes just to work on core strength or just something to keep my body moving, practicing what I preach, right? Um, Yoga is also helpful. Just these are my own things. It doesn't have to be these things, right? Um, Taking care of myself so that I can take care of others, and that might look different for everyone. I like to do resistance training as well. Um, yeah.
You mentioned the importance of asking for excuse me for of asking of help from others, but you also mentioned technology such as the zero gravity treadmill and the exoskeleton. Do you have a favorite piece of technology that you like to use yourself in order to help rehabilitate your clients and your patients?
Full disclosure, I'm not sponsored by any of these companies, but I really like the harness supported treadmill systems. Um, because they allow me an environment to really challenge the patient. I tell my patients I want it to look ugly in therapy. I want you to make mistakes, but in order to do that safely, I need something to hold them up, right? So they don't fall and get re-injured. So those that would be my favorite piece, I guess, because it has so much versatility in there. You can change. It's like a normal treadmill, right? I can bring up the incline. And you can cover a lot of distance. Maybe you're in a smaller clinic and you don't just want to do laps in a circle, right? So the treadmill's continuous. The robot, I think, is a fancy bell and whistle type of equipment. Not everywhere is going to have it. It costs as much as a house, pretty much, and it's super robotic as well. So it's a good tool. I'm fortunate that where I work, we have it because maybe at first, right, just to get the patient standing and for the first few sessions, making sure their blood pressure is not dropping, they're not passing out. There's a lot of complications which can occur as well after this type of injury. Um, but as quickly as I can, I try to get out of the robot and into that treadmill, which is my favorite.
Nice. We talked briefly about the confines of insurance. There's so much new research coming out daily, weekly, monthly. There's all this new technology comes out, and we know that sometimes insurance could be a little bit slower to allow doctors in order to try out new ways of therapies and be creative. How are you able to overcome those limits, or and just make sure that it's not impeding on what you want to do with your patients, or how do you even maybe even become even more creative with the confines of the insurance that are placed on you.
Yeah, it's a challenge, and it's something that we'll continue to fight for and advocate for is for those policy changes to get these people the care that they need and deserve, quite honestly. Um, but it's a challenge. I'm not going to sit here and tell you that we have a solution. Depending on what type of insurance you have, obviously some are better than others, but once again, after this life-changing injury, someone might only get 6 visits of PT, and it's like, what am I going to do with 6 visits? It takes, just to put into perspective for your listeners, anecdotally, and I'm not citing a research study or anything right now, it could take anywhere from 30 to 60 PT high intensity sessions to make that walking recovery, for example. So if you have 6, I'm not even going to start working on it, right? Because there's other things that I need to show you and teach you to prevent you from going back into the hospital. So it's a challenge. I think a lot of it is also teaching the patient to advocate for themselves as well. I think a lot of it also comes down to how much the patient is willing to fight for themselves, calling their insurance up and saying, "Hey, I need more therapy." Right? They pay monthly for this, so I always encourage my patients to, "Hey, you're the customer. Call them. They'll listen. Anything I can do to support you, I'll do." Um, to get someone a wheelchair, for example, from insurance, like a custom wheelchair, I have to write like a 9-page letter to justify that, hey, this person can't walk, so you should pay for this wheelchair, which is right kind of crazy to think about, but that's what it takes. And so we do it. So we do it. Um, Home exercise programs, giving them as much as they can do at home. If they have a support system, if they, I have this one patient who's so that it's a couple and they're a little bit older. My God, they're amazing. Like the husband has created like a whole adapted gym inside their home. They
Beautiful.
used to drive an hour to come, go through therapy. So how innovative can the patient get, right, with their caregivers? And everyone's situation is different. Sometimes you have people who don't have insurance, and now what do I do, right? So there's also a lot of resources that exist. So I think for clinicians, so that was like all like what the patient can do, but as a clinician, it's reaching out to colleagues. I'm sure you'll give them my information. Anyone that's a therapist and listening to this that's working with a patient, I'm always willing to help point you in the right direction. So there's different funding resources that exist in the United States, foundations that provide funding for these folks. It's just about knowing and then applying, right? Um, where I currently work at Orlando Health, a nonprofit hospital, once again, one of the reasons why I love where I work is we will provide care to people with financial hardships and stuff. So we're not going to deny you care because don't have insurance or what have you. But there is no solution. It's a case by case basis and using what other people in their life and what other resources do they have. And sometimes it's a sad situation.
Yeah. We mentioned resources a little bit. A patient is done with you for the day and they're going home now. What advice do you have for family members and caregivers on how to go about making sure that patient is safe when they're at home?
Yeah. Um,
Especially
you
because we
know,
see a lot of things like bed sores sometimes and stuff like that. Sometimes a patient may be sitting too long. Is there any advice that you have there about maybe just, at least having them in high enough spirits to keep them active, maybe in their chair?
yeah, for sure. So, and I'm glad you just brought up the bed source too, because I was just about to comment on that, right? Because everyone wants to think about, or naturally we think about walking. Um, the spinal cord does a lot more than just control our limbs. It's so, but when you're in the hospital and after this, once again, life-altering injury, there's so much education coming at you. It's like drinking out of a fire hose, and you can only take in so much. So my advice to patients is always, when you go home, it's going to be kind of a shock. You're not going to have 24/7 nursing. You're not going to have everyone right here, and it can be scary. So expect that. Expect ups and downs. You're gonna have some real shitty days. Then you're gonna have some real great days, right? Just take it one day at a time, and you're gonna be all right. Like you'll get there, right? Um, as far as the pressure reliefs and the bed sores and everything. So what we really ingrate in their brain is a pressure relief schedule. So whether you're really, they should be up in their chair all day long. And the chairs, the reason you need such a custom chair is so that you can tolerate sitting in it for about 12, 16 hours. So we encourage them to get in their chair, of course. But doing pressure reliefs like we've taught them in therapy, every 30 minutes you should do one for like 3 minutes, and then every 2 hours you got to change your position completely. If we think about our day to day, like even right here while having this conversation, we haven't thought about it, but we've, every now and then switched our bottom around. So if you're not getting those signals though, because you've had a spinal cord injury, so you don't feel your bottom and it just keeps, that's how those bed sores occur. um and Johnson, to be honest, dude, I wish it was, well, it's just kind of part of the process. Sometimes it just has to happen for them to take it seriously and learn. I love my patients with spinal cord injuries. They're the most inspiring, amazing people, to be honest. Um, but lo and like most of the time, and the number one reason for readmission to the hospital
They're
is a
hard-headed.
bed sore
Yeah.
once you got home. Yeah, and it's sometimes it's just things we don't think about. So I'll give you an example, and it's the patient reached out to me. She said, "You're going to be so disappointed in me, Dr. Z." And I was like, I highly doubt it. What happened? And she was visiting her, she's 24 years old, by the way. So she was in a car accident, and ended up paralyzed from the waist down. We actually couldn't work towards walking. It was a very bad spinal cord injury. So teaching her how, well, now how do you move around? How do you get independent? And she was amazing. But once again, she had her rough days and her bad days, days where she wanted to quit, and helping her realize you are not your spinal cord injury. You are you. I'm not going to obviously say her name, but she went on vacation to visit her family in North Carolina, and it was chilly, right? So she was under a blanket, and um, she was sitting next to a heater, like a portable heater, and she didn't feel the heat on her leg, nor does she think about this, nor do I really expect her to so soon, right? I think that's unfair to expect her to. Some people, some providers might say, how could you do this? But her leg ended up blistering and
Mm.
boiling because she was
Mm.
sitting too close to it. And if you don't look, you just happen to look, you don't know, right?
Right.
And she had to go back to the hospital with stage 3 burns and getting skin grafts. And now that's a learning experience, not the most optimal, but we do the best we can, right? Setting alarms on your phone, doing different tools and memory aids and stuff. But yeah,
Yeah, it gets tough.
there's no short answer to any of these questions,
Right.
man.
Now, every now and then you get a story like that, but are there any success stories that you could share, even whether you've seen it or even heard about it?
Well, that's still a success story. I want, so she went to the hospital. She got the skin grafts. Now she knows. And at first she was like beating herself up, but now she's fine. Hey, you live and you learn
Right.
with anything, right? We make mistakes and we learn from them. Now it's a lesson. So I don't. I still think it's a success. I think it's a success story if the patient's trying.
Mm.
That's the success, right? Just
Love
not
it.
giving up. Um, and they're everywhere. I so any success stories. I'm there's so many, right? Because once again, these are the most amazing people ever. Just when I think about the stuff that I'm asking them to do, it's crazy because I don't even know if I'd be able, knowing everything I know, and seeing the other side, and they haven't seen the other side, right? What I'm asking them to do is crazy. Like to really, hey, I know you're not walking, but come on, like you got to do this. Life's not over. Come on, get up. I don't say it like that, of course, but in
Right.
the end of the day, right? Like, so people that maybe in the hospital were depressed, which obviously everyone's going to have some sort of depression, and that's normal. That's okay. Um, but not wanting to participate in therapy maybe, or sometimes, they'll be under the covers. But then they come visit me maybe in our SCI reunion that we have once a year, and they are back in school, in their wheelchair. They're driving. They're advocating for other people with spinal cord injuries. They're maybe they're doing adaptive sports. So those are the success stories when they're able to just reintegrate into the community, go hang out with their friends again, right? That, and for the most part, that's how it is. It looks different for everyone, but everyone ends up coming around. Um,
You know, an important success story, I think, is all the doctors who are able to help their patients get through SCI and TBI injuries, and even when it comes to different type of injuries, within physical therapy, sports injuries, whatever it may be. But I wanted to speak with you specifically because you happen to be, and I don't know if you know this, but you happen to be one of the more popular physical therapists in Orlando. You went to UCF, you're working in Orlando Health right now. Everybody knows and loves Dr. Z. Can you tell us how your journey was, especially when it came to the UCF DPT school, and what involvement you still have with UCF today?
Johnson, you were too kind. You're gonna make me blush on camera, man.
I'm trying.
Yeah. Um, so my journey was, I think, a little atypical. I really, so growing up, I'm gonna take it a little bit back. Three options: doctor, lawyer, engineer. Guess what? I didn't want either of those. I wanted to start a business. Three options, meaning from my parents and
Yeah.
stuff. Just either way. So when I was going through my undergrad and taking some of these prereqs, I didn't really have my why as to why I want to be a PT. I was just doing the bare minimum, C's get degrees, and trying to start a business. So the first time I applied to 19 DPT schools, and I got one interview, and I didn't get accepted to anywhere. And that was the best thing that could have ever happened to me because it made me take a step back and ask myself. That's when I learned even the question about why am I doing this, right? Something as simple as that. And so I did some volunteering. I worked with some people with disabilities and just right doing the observation hours. And I got my why, and that's all I needed. So I applied to three schools, UCF being one of them, the following year, and I got accepted. Now, once I got accepted, the first day I was like, I don't belong here. Like everyone here in my class no one had gotten a C. Can you believe that? And I'm coming in like, wow, I've gotten D's before, and like I can't sit with these people. Like imposter syndrome, so bad. I remember having to YouTube how to study, you know, and I don't know what it was. It was kind of like PT school kind of transformed me. Like I think it gave me my why, of course, and kind of that drive to become better. But I think as once again, YouTubing how to study and then trying it and then being able to do it, I'm like, wow, I can do things as long as I'm trying to do them. So I ended up never thought I'd do this, but I ended up becoming the president of my cohort because they needed one. And I was like, well, I'll apply. I have no idea, right? So I just kept taking opportunities which I thought would be challenging, and became better at them, I guess. During our PowerPoint presentations, I remember, dude, I would go up there and be super sweaty, just like presenting to my class on like a slide. It shouldn't be. It's like a group project. Um, but being in front of people and having to talk, getting nervous, and my hands were shaking and stuttering and all those things, and you do it again and again and again, and you become better at it. I still get nervous till this day when I have to like go give a speech or something, but it's worth it, and I'm doing it right. It's for the patients too. So I don't know if I answered your question, but
You did, but there's a little bit more to it because now from UCF you decide to get involved with Orlando Health, where you are at now. How has Orlando Health helped you become the doctor that you are today?
so the mentors I've had at Orlando Health, shout out to Kristen Cesat, definitely as a main one for, especially for spinal cord injury. So when I was in PT school, and going back to when you asked me, what made you want to do spinal cord injury? When I was in PT school, you have like a white coat ceremony before you go out into the clinic. So you get your white coat, so now you can go treat patients under supervision, of course. Kristen Cizak came to our white coat ceremony and gave us whatever, like your little pep talk before you go. She was a keynote speaker. And just the way she talked about her patients, and just like her advice was like, listen to your patients, they'll tell you everything you need, like things that now seem obvious, but and everyone I'm sure has gone to the doctor at some point. Not We're not all created equal. Like someone, they might treat you as a diagnosis, but then you've also had those interactions with someone that like you're like, wow, they were amazing because they listened to you, right? So I was like, I want to be like that lady, you know? And she happened to work at Orlando Health. So I did my rotation there, my last clinical rotation there. Uh, got to kind of learn from her, and then I chose to do a optional residency in neuro, and she was one of my mentors. All of this through Orlando Health and UCF. And so I say it's the organization because it provides us the support we need to be able to do those things for the most part, but it's the people within the organization more than Orlando Health itself, because the people within it are what make it so great, you know?
Yeah, nice. As a DPT, you work with SCI and TBI right now, but are you allowed to work with other niches within DPT as well? Maybe working with athletes or just people who sustain an everyday type of injury. Are you able to move around?
Absolutely, absolutely. One thing I love about the PT profession is it is very versatile in that way. So there's pediatric PT. At one of my clinical rotations, I worked with like little NICU babies, which was insane to think about. And that's a whole nother world, which we could get into. But so yeah, there's that. There's pediatrics where they're children in school. You could work in a school, you could work at a clinic. Um, then there's sports PT, right? Whether that's for maybe your weekend warrior, your 40-year-old CrossFitter with maybe back pain or shoulder pain, or at a professional level with the NFL teams, for example. Then there's geriatric PT for older people, preventing those falls, preventing the spinal cord injuries from happening in the first place, extending their life, right? Giving them community, what do you call it? Community wellness programs. So anything you can think of, a PT could, kind of sneak into. I want people to think of physical therapists as essentially the experts of the movement system. So just when I say movement system, it's like it's everything, right? Not just the way I think of movement is it allows us to interact with our environment from the day we're born, right? A baby opens their eyes and starts looking around so that we can start developing our perspective on life. And whatever way you want to help someone get better at their movement as a PT, yeah, you could sneak in anywhere.
Nice. You mentioned the perspective on life and how one of the, I guess, most important things or messages that was relayed to you while you were studying to become a DPT was listen to your patients. Do you have any advice for the DPT candidates right now, no matter what school they're at, as to how they could become a successful doctor?
Yeah, that's a good one. Um, you know, most people in DP or all people in DPT school, you got in because you're smart and you you know that part's obvious, but you don't need to you need to respect your patients, of course. Number one, mutual respect there, but prioritizing that therapeutic alliance. I'm going to say that word again. Really get to know your patients, actively listen to them. Something that starts happening in routine is like I don't answer that question, am I going to walk again, the same way every time I answer it. I could choose to do that, but I'm paying more attention to those like soft skills, like what is the body language of the patient, the tone in their voice, right? Those soft skills are really hard to teach someone from like coming from someone else, but if you're trying to develop them within yourself, it comes easier. So work on those, and also prioritize your self-care. That's another thing too. So going on those soft skills and being able to actively listen to your patients and being able to be empathetic, which is trying to put yourself in someone else's shoes to see things from their perspective, takes you being in a good mindset and state as well, right? If you're already frustrated at life, or there's so much to be grateful for, right? We got a roof over our heads. You got food on the table. Like, let's start with that, right? Don't everyone wants to complain about, I don't make enough money. Whatever it is, the list can go on and on. We take things for granted. So by reminding ourselves what to be grateful for, we'll be in a better mindset state and being able to serve others better. If you're walking around all negative and hating life, well, yeah, you're not going to want to really listen to the person that's now complaining, right, in an office to you about their back pain, so to speak. So, yeah, I would go with that.
I think that's great advice personally, if you ask me. Dr. Z, I want to thank you again for coming on the Square Feet of Life today and sharing your story and sharing all this great information with us. I know that you have a podcast. I know that you're very big on Instagram and all your socials as well. Where can people find you if they wanted to reach out to you and listen to your podcast?
Yeah. Johnson, thank you so much for having me and giving me the ability to share some of these things. I'm obviously very passionate about physical therapy in general, so thanks for the platform. Um, Hopefully my answers weren't too sporadic, but
I thought they were great.
good, good. Hopefully your listeners agree. But on Instagram, you could find me at Dr. Z Neuro PT, so DRZ Neuro PT, and that's really my tagline for most things. So if you put that in Google, or you could Google my name. Um, if you're a PT student, I encourage you to do that because I have there's information on to guide you through PT school or maybe scholarship programs that might come up if you Google that. Um, but I'm on all the socials with that tag, so TikToks, all the things.
Nice. Dr. Z, once again, thank you so much for coming on. I actually do look forward to having you on here again, as there is so much new information and research that comes out more and more. And so I look forward to speaking to you about that again. I wish you the most success and congratulations to everything that you have going on for you at the moment.
Thank you, Johnson. Appreciate you.
No problem. Thank you guys for tuning in. Don't forget to subscribe, and I'll see you next time.